And we welcome you once again to United in Liberty Radio, where we talk about all things principle. Dustin Harris, Joe Olivas, co-founders of United in Liberty, and we're back on the air talking about things as they are, as they were, and as they are to come. Good evening, Joe. Welcome.
Hey, how you doing?
I'm doing great. It's been a good day, and excited to get back on the air and talk about some things that are going on in the news and talk about how they apply to principle. How about yourself?
Oh, I'm really excited about what we got to talk about, some kind of new developments with our illustrious president's new law, healthcare. Some of the one of his appointments. I think people are starting to learn a little bit about who this individual is. Donald Berwick. He's got some interesting views, Dustin.
Well, he's a Harvard professor, so I think that says much about who he is. Yeah, he does have some interesting views. Let's get into a little bit as we try to apply this to principle. Of course, these are things that are being talked about in the news, both on a national and local scale, wherever you may find yourself as you listen to this program. But one thing that sets us apart, of course, from the other talk show hosts out there is we're going to apply it to principles, specifically the 12 principles of liberty and principles in general. As Joe pointed out last week, and I think it is worth repeating, a great test to find out if something is a principle or not is simply to ask yourself, does this apply in every circumstance that we find ourselves in? In other words, can you apply it to family? Can you apply it to your business? Can you apply it to your to your church activities? Can you apply it to your hobbies? Can you apply it to government? It doesn't matter. A principle will apply no matter where you find it.
And that's interesting. I mean, a great way to point that out, I think, Dustin, is just simply because once an individual has learned to train their mind to live by principle, it's easy to identify when a principle is being violated. It's easy to identify where those blind spots are in our lives to be able to avoid being taken advantage of, to avoid having something occur in our life that we could otherwise prevent if we could have foreseen it. So it's good to be able to train your mind to be able to understand, recognize, and then live by principles, and more specifically the 12 principles of liberty when we're talking about their Constitution, our government, and how our elected officials are attempting to run our lives for us, if you will.
Well, let's talk about Dr. Berwick.
He's got a great resume.
He does have that. The article that I have in front of me comes off of Yahoo News, dated Wednesday, July 7th, by Erica Werner, Associated Press. She states that President Barack Obama bypassed the Senate Wednesday and appointed Dr. Donald Berwick, a Harvard professor and patient care specialist. See, the Harvard professor thing is capitalized, but patient care specialist is lowercase. But he's going to now run Medicare and Medicaid. What do we know about Dr. Berwick, Joe?
We know a great deal about this individual in the short period of time. One of the things that I find most interesting is that this is by bypassing the Senate, he's making it possible for this individual to not be questioned by Congress should they so choose, to get to know who this individual is a little bit better, and to be able to make sure the American public knew who this individual was. But after reading some of the information about Donald Berwick, Dr. Donald Berwick, there's some validity out there to some of the comments and some of the complaints and concerns that were being made early on referring to death panels. Not that there is going to be a group of individuals written into the law, there isn't anything written in the law that says there's this group of individuals that can decide you get care, you die. There isn't that in there. However, if you
You're saying there's no death panels?
No. Well, hold on. Not directly, but indirectly by appointing an individual like Dr. Berwick here.
Are you telling me that Sarah Palin is wrong?
No, I'm telling you that she's right in that how it's being presented. And her response or what she was sharing was painted as being wrong in the media, meaning she gave an analogy or she gave an expression of what she felt was this healthcare law was going to do. That was correct, but the way the media was portraying
because the phrase doesn't say death panel.
Because it doesn't say death panel, I mean, right. She's right, but the way the media spun it, she sounded completely wrong.
Where'd she come up with this crazy idea of death panel? I don't see those words in there.
Yeah, I didn't see it in there, and a lot of people didn't see it in there, and anybody that supported Sarah Palin at that particular time was a nut job. They were way out there.
As opposed to the other times that they
as opposed to the other times. And so, but here again, I think there's a lot of validity to it when you look at who this individual is and what his views are. There is no reason why the president would want this individual to be questioned by Congress. None. Because if he is questioned by Congress and some of the very controversial statements that he's made in the past, that is going to resurrect that argument in a much larger scale. And with Obama's numbers continually to drop, his popularity continuing to drop, and people continuing to get frustrated with who he is and his administration, he does not want this type of heat to brought down on him.
Well, tell me what you're talking about specifically. In other words, you're saying that this individual has made comments, made statements in the past then that apply or seem to support what Sarah Palin had been saying during the election time. Actually, after the election, but during the time that they were starting to discuss the whole health care issue, she talked about death panels. You're saying that he has said things that support that.
He absolutely has. Now let's understand death panels. The death panels, the way former vice presidential candidate Sarah Palin was bringing up, she was talking about a rations type healthcare system where an individual could be denied health care coverage because of the cost of the coverage, because of the type of the coverage, based upon that individual's age, kind of looking at their human life value.
Right.
Human life value is a term that's generally understood in insurance. And so the way human life value is, before you get your insurance, they're going to determine your age, they're going to determine your working ability, they're going to determine your health, and that is going to come up to a dollar amount, if you will, that represents your human life value, what you will be able to contribute to an economic standpoint through the course of your life. Now, it stands to reason, as you get older, your human life value from an economic standpoint drops. So then the value of your life drops. And so some of the arguments that Sarah was making was there's going to be a time when an individual is going to be seeking coverage, but because of their age, because of their health condition, and just that particular type of service that they need, it's going to be weighed by this supposed death panel, or this group of individuals, or this arbitrary individual is going to decide whether or not it's financially responsible to take care of that service.
Right.
And then let's say you're in your late 60s, late 70s, and you need a hip replacement. But you know what? You really don't contribute to the working force, Dustin. So, I mean, you're not paying taxes. It's kind of a drain on the economy.
You're accepting Social Security.
You're accepting Social Security. You're not really contributing. So, the hip replacement, I mean, that's a really expensive surgery. We're not going to put you through that because that's going to be difficult on you.
Don't we do that with our cars, our vehicles?
Oh.
I mean, don't you? When you've got, I'll give you an example. I used to have a van. We called it the Green Machine. It looked a lot like the Scooby-Doo van. In fact, it looked a lot like the Scooby-Doo van. And, it got to the point that the Scooby-Doo van, the Green Machine, was old. It was rusted out. There were some major problems with it, a lot of minor problems with it. We got to the point that we had a transmission slipping. Okay, we had to make a decision at that point. Do we junk the van or do we fix the transmission? To junk out the van was about $300. That's how much we would get. To fix the van, we would have to pay about $3,000. So what do you think we did? We didn't replace the hip, Joe. The hip surgery was on the Green Machine. It wasn't working for us. So we junked out the. In other words, you're saying that we're making the same decisions for a human being as we would for an inanimate object.
Yeah, and that makes sense for an inanimate object, just simply because there's no. It's a thing. A thing can be replaced. Things can be replaced all the time.
This was the Green Machine.
Well, I mean, you still had the Green Machine. I mean, you could have junked it, not paid for it, let it sit in your, the kids could have been playing in it.
Okay, good point.
But here, it's just a thing. Things can be replaced. People cannot be replaced in the sense that when, when